New video, and this one is for mon ami du Québec. He's a special request for some the fracture and the management of fractures in the wilderness. This one will go 4 different parts if we want to. So the first one will go general introduction about fractures, how we manage them, and then we're gonna go from navel up, the navel down to the top of the femur there, and then all the way to the leg down. And we'll try to see the different treatments and go to the bones. I'm going to use these books. It's called Orthopedics Made Ridiculously Simple, and I'll put a line. It's mostly for doctors. But it's very well done and very well explained, so even somebody that doesn't have much medical training can require some good knowledge out of that. And we're going to try to... It's pretty complicated structure. And like I said, we drill sometimes holes in the bones to give them medication, and we can administer all medication in an emergency setting. Pretty much most of our bones are made the same, and I don't want to go too much into detail of anatomy and physiology, but the important part when you have a fracture is which part of your bone is fractured and where. Closer it gets to the joint, so the elbow, the wrist, shoulder, hip, we're going to treat them differently. The reason is that if it is, because sometimes you can have what we call a fracture dislocation, so basically the impact was so big there was a dislocation and a fracture. And in those cases, you have to be a little bit more careful about what you do, because you can create more damage, and we'll see it. It's mostly on the femur side and everything. As for dislocation, should we start pulling on arms and legs and replace them in place? I'll let that be the judge. I'll put down a link to an article in the Wilderness Medical Society. And we're talking about medical professionals, so basically people that does that all the time, versus lay person replacing and the risk of complication from it. And they were saying that there's not that much. But again, most of those people need to be trained somewhere. So if you do a course, mostly if you do a wilderness, I believe around first responder, and even I think at the level of first aid, depending on which course you take and who is giving it, they will show you a little bit of arm reduction, ankle reduction. And the reason is that you can risk benefits to replace. For example, if the person has an ankle dislocation and you don't reduce it, the pain is terrible. And not only that, is that the chance of you replacing that ankle inside the joint, and this person be able now to get out of the woods alive, kind of go against the minimal risk of, for example, clipping a nerve into the bone, which is one of the complications you can do, stuff like that. And they say that basically the benefits outweigh the risk of doing those procedures, even if you're not medically trained. But again, it comes back to do your training, I won't show here how to replace those things. Those things you need to be at least on the first course, and how to do. There's books on it, and basically when you replace, so imagine this when it's dislocated. So basically imagine that this is my socket for shoulder or whatever, and basically depending what happened is you're out of the socket. And what you're going to do is you're going to do a procedure. And don't forget that here you got muscles and other fibrous tissue holding it up. And what you need to do is basically either go against those that are trying to pull it this way, or let them fatigue so much that basically this thing will just want, because it wants to be there, right? Because that's what it was meant to be. But right now, for whatever reason, it's hold this, and you have such spasms in the muscles and everything. Those people, when we're in an emergency, what we do is we give them a medication and put them asleep. And when they fall asleep, they kind of relax a little bit, and then we're able to pull it a little better. It's very painful, but in a situation of wilderness, it could save their life as well. So I'll let that be the judge, and I'll let you read that art frame. And it's very important. And go do a course, because even if I do videos like this, they can be useful, but they don't replace pure training with an instructor really telling you if you're doing the right technique or not the right technique. So let's continue on that. So basically, fractures. You can have different kind of fractures, and I'm going to show you one picture over here. And basically, this is what we call kind of a transverse fracture, and as you can see, the one with the B here, so it's transverse like this, but it's non-displaced. So basically, it means that the bones are still kind of in line there, versus C, which is the same kind of fracture. See, I have the same line over here, so C over here, but this is displaced. That means like the leg is totally on the other side. E here is intra-articular, so again we were talking about the articulation, and those are the fractures that also, if it's very close from the articulation, you want to be careful about what you do there, because now you can do more damage depending on what kind of stuff you do. And D over here, it's a communicated fracture. So basically, for example, if I jump and land on my feet, if I compress, it's pretty much what's going to happen. It's basically I get two different force. So I got a force applied from here and a force applied from there, and basically kind of bursts. Right. So if a force goes one way and the other way, then the bone structure cannot take it. So if I put a pressure here, as I put a pressure here, it becomes like it's going to shatter. So that's how you break the legs into different shreds. So on this fracture here, we'll see what's the treatment basically we do. So as you can see here, this is what we call a displaced fracture. And so basically it's broken, but as well as the foot is one way and the other. This is not a relocation. It's just different. It's not a dislocation. So it's not like a hip dislocated over here. It's just basically you're positioning the feet in the position to try to do a better job of securing it. So it's not a dislocation maneuver. And basically you see here the leg is back into its position, and then it's splinted. If this situation, so for example, if the leg would be on one side, you try to bring it as much as you can.